the latest information related to treatment options for limited stage LS and extensive stage ES small cell lung cancer? And how do you work with your patients to make treatment decisions about that?
So this is unfortunately a disease where little progress has been made throughout the years because it's a very aggressive disease. And the main improvement that has been made in the last 5 years is the addition of immunotherapy to chemotherapy in patients with extensive stage disease. There has now been several clinical trials that have shown that adding immunotherapy improves overall survival. That means that patients live longer, and there is a very small, but a few patients that have the disease survival into the many years, which is something that was unthinkable before the era of immunotherapy. We do not know if the addition of immunotherapy to limited stage disease, which treatment is in the majority of cases chemotherapy radiation, we do not know if that works or not. There are clinical trials that have that are going on. Most of them have completed accrual, so we're just waiting for the data to mature to let us know if that is something that also works there. We have a lot of hope that is the case, but right now in September 2023, we do not know the answer for that. How I work with patients to make treatment decision is I present them with the options of the treatment. So there's always options, from being as aggressive as we can to treat it, to try to shrink the cancer, which many times comes at the price of side effects, to just doing best supportive care, which is we know that sometimes shrinking the cancer is not what is going to make people live longer. So it's a conversation that we constantly have with patients where we say, this is what we propose. This is what the consequences of treatment is going to be. And these are the alternatives. And you have to work with them depending on their goals, depending on what they want to achieve. You make treatment decisions. Ultimately, what I tell my patients is, you're the captain of the ship. I'm here just to help you navigate this rough waters, but ultimately you're the one that needs to tell me where we want to go. Okay. An activation tip is patients need to make sure that they know what the goals are. How am I going to feel in the next month? What is the likelihood that this cancer is going to shrink and this cancer is going to make me live longer? Those are the questions that they need to make sure they understand. And something that they want to know is, what are their goals? It's very different if you see a very young patient. Their goal is to see their high school kid enter college, than a 90-year-old patient that their goal is maybe to live the rest of their life with the least intervention or the least side effects possible. So every patient has different goals.